Next, let's hear from two of our Oracle leaders. Many of you heard last month that we launched our Autonomous Shield initiative to simplify and accelerate Oracle Health EHR migrations to OCI at no additional cost. But what does that mean? And what is Oracle doing to help not just our healthcare customers, but customers across several industries? For this conversation, I'm going to hand it off to Mike Sicilia, Executive Vice President for Oracle's Industries. Now to you, Mike.
Thank you for leading that conversation, and to Russ and to Scott for your healthcare industry peer view on cybersecurity. As you may be aware, we run many vertical industries at Oracle, not simply healthcare, but lots of different vertical industries: telecommunications, financial services, retail, and so on. And as such, we are seeing cyber issues really firsthand, and cyber challenges across all these vertical industries. And I think we can offer a perspective across industries that it could be, I think, very useful in healthcare. So to help me discuss that, I'm more than happy to introduce Oracle's Chief Information Security Officer for Health, Steve Fridakis. Steve, welcome. Thanks for being here.
Thank you for inviting me. I'm totally honored to be here.
Thank you very much. And just as a reminder, before we get started in the conversation with Steve, which I think you'll find very insightful, feel free to use the Zoom Q&A along the way. If you've got questions or feedback or comments, please go ahead and use that function as we go forward. So we've all heard a lot, and we just had another conversation, just before this, about the challenges plaguing the industry, and the reasons for some of those challenges, whether it's dated infrastructure, whether it's internet-facing portals, or quite simply the fact that healthcare data is very valuable, and therefore it's unfortunately a big prize for bad actors. And in the midst of all that, there are ongoing debates around AI, the usefulness of AI, and all these kind of things in healthcare. So there's certainly a lot going on, a lot coming to a head, and lots of decisions that have to be made, I think, in pretty short order, to really think about how do we secure our borders, what's the role that AI plays in that, and how do we protect this critical asset. So Steve, you just started the conversation that we all did with Russ, Scott, and Dr. Flemings, and the cybersecurity challenges that they see facing healthcare. From your point of view, what are you seeing? You're dealing with some of the biggest healthcare organizations in the world, our customers. What are some of the biggest challenges that you're seeing those organizations face in terms of cybersecurity?
The biggest technical and cybersecurity challenges healthcare organizations face are not technical at all. We have legacy systems to integrate. We have a shortage of professionals that we're trying to hire. But these are symptoms of what I believe is a deeper problem, and that is lack of cyber consciousness within the healthcare industry itself. Now here's what's going on. We place our focus on care over security. Healthcare industry provides patient care above all else. So that leads to a culture where cybersecurity measures are seen as burdensome obstacles rather than essential safeguards. We give emphasis to usability and patient well-being, especially in time-sensitive emergencies. I have been a volunteer EMT for many years, and I have witnessed passwords on emergency room devices. I have seen people struggling to get information, sharing over-the-counter, what I would consider quite sensitive stuff. Now, this is something that is tolerated in the industry, and we need to, again, think about it as something that we deal with every day. Patient data is scattered across disparate systems, making it quite difficult to track, to secure, to manage. Many healthcare organizations look at outdated medical devices, and those need to be integrated now with systems such as ours that operate in the cloud, and they are quite complex to do so. So the opportunity is that upgrading these systems can be costly and disruptive, but the risk of a breach due to vulnerabilities is quite high. The healthcare industry is constantly bombarded with new regulations and compliance requirements that are so difficult to understand And frankly, their mandates for very few days of notification and something else is quite overwhelming for understaffed IT security teams. So this is how I draw the environment that we are asked to operate in.
Well, thank you for that insight, Steve. I mean, obviously, lots of fascinating points there. And let me share some stats from other industries. As I mentioned, at Oracle, we're operating in many vertical industries, and then come back to why these global stats are so acute and such a big problem in healthcare. But according to IDC, 33% of organizations worldwide have experienced a ransomware attack. That's 33%. And they're the ones that we know about. Obviously, so much more out there that are latent or so-called Trojan horse attacks where organizations are infiltrated and unfortunately might not even know it. 82% of all data breaches involve the human element. Now, you just gave a perfect example of that, Steve, with the password on a sticky note as you were an EMT and seeing a password somewhere stuck on a monitor. And, that's, again, a human elements issue that unfortunately is really low-hanging fruit here. Or in some cases, we see breaches that involve no passwords at all, where somebody forgot the password protect something. There's a lot of very old technology in healthcare. Passwords weren't always required. They were optional. And people may be running these servers for years and years and years and forgetting that they didn't password protect them. These are really easy pickings for bad actors. And then 92% of organizations that we at Oracle surveyed said they have a cloud readiness gap that places them at risk. Now, there's some wide-reaching, stats across all vertical industries. Let's come back to health for a second and why these vulnerabilities are so acute. There's a really interesting fact. On the dark web, bad actors can sell personal health information for 50 times more than they can sell credit card information. So credit card information is really no longer as valuable to bad actors because of the fraud detection and all the reasons that credit card companies can shut these things down very, very quickly when they suspect they've been stolen. Personal health information may take us a while to figure out that your health information has been stolen. And obviously there could be some very compromising information. So 50 times, put that in perspective, 50 times more valuable to bad actors than credit card data is health information. And this one really gets me. 1/3 of Americans were victims of a health data breach in the last year. That's the part that gets me. In the last year, 100 million Americans were victims of a health data breach. Most probably don't even know it. We all see the Change Healthcare cyber attack in the news, which has been in the news for many, many months. Unfortunately, still lingering effects from that.